why are you and your fellow nurses against these guidelines? What does the guideline say, and what do you want to change about it?
The important thing to note is that it goes against human rights, and it's every human have the right to move about freely where possible, and we have every right to decide where we want to practice. So this circular goes against that. In the School of Nursing, you're supposed to school for 3 years and become a registered nurse, and then before you start, you're supposed to do PTS, what we call the basic or prelim,
Okay.
the first year and all that. So if you add this number of years to just become a registered nurse and then to go out and do what you want with the license you paid for by yourself. A lot of us, our parents had to sell markets, sell things, do businesses just to foot our school fees. So this verification guideline goes against every human right in any way. Nurses were not funded, nurses were not freely trained, so nobody have the right to restrict your practice. Nobody has the right to dictate for you where you should practice. In developed countries, nurses can be verified at any time possible, because you should be able to know that the nurse who's looking after you is licensed, is practicing, does not have any restrictions to their license, and any employer should also be able to do that, and it should be available within 24 hours. In the UK, it's available within 24 hours. In the US and Canada and other developed countries, this is the best practice. But in our case, they are saying you have to stay back and practice for 2 years. You also have to wait 6 months for this to be processed. You need to get a letter of good standing from your employer. And also, so these are the things around it. It just sounds as though we are children, we are minors who do not have a right of movement and a right to wherever they want to practice their career.
Does it seem like this is targeted at people who might want to practice abroad, or does it also affect nurses who might want to practice in Nigeria?
So basically, from a myopic, a very short-lived point of view, it is meant to be targeted at those who are planning to move abroad to practice. Recently, we had a news where the presidency is urging Nigerians abroad to return home, to doctors and all that, to return home and boost the healthcare sector. We also had news back then when there was some saying that you have to stay back 5 years before you start planning to move abroad. This was targeted at doctors.
Yeah.
But that didn't come into limelight. But then all of a sudden, there was this circular against nurses, and it's targeted to prevent nurses from moving abroad. And what they said was because the healthcare sector is short-staffed, there is drain. But I can assure you from some of the documents we have received, at least every state in Nigeria has at least 2 to 3 schools of nursing. These are state and federal. And then we also have some schools of nursing by some other hospitals. So in almost every state, you have at least 2 to 3 schools of nursing, and each of these schools produce ranging from 50 to 150 nurses twice a year. So just to make it clear, the nursing workforce in Nigeria is not short-staffed. There is no statistics showing that the nurses are short-staffed. Rather, we are having higher volume of nurses who are in the streets unemployed, because most of these hospitals or private hospitals prefer to employ staff and cheap services, and then they employ 1 or 2 nurses and they say, oh, this is what we'll pay you. And you have nurses who are being paid 30,000, 25,000 in most of these communities. The government is not really recruiting, and this is why most people are moving abroad, because there is global opportunity for nurses. But then this circular has just been brought in, a barbaric circular that tends to reduce or truncate that dream of registered nurses to move abroad.
Kelvin, I believe you'd agree with me that no responsible government will be satisfied with the brain drain that Nigeria has. If you have your people living at this rate, you have to be concerned. Maybe I might not go about it like this, but it definitely is the cause for concern of any responsible government. Do you agree?
I do agree with you that it calls for concern.
Okay.
However, I do also believe that, as it has always appeared, the Nigerian government do not always solve the root cause of problems. However, they just prefer to chase shadows. For example, you have your house burning and there is smoke coming out. Instead of you to quench the fire, you go about covering the windows so that the smoke does not go out, or you go about painting it from the outside so it doesn't look as though it is burning.
Wow.
The reason why people are there's a lot of brain drain is the high rate of unemployment, high rate of crime, social insecurity, kidnapping, and a lot of it. If you go to UPTH as we speak, that is where I train. In the evenings, you see that there is no materials for the nurses to work. Patients are being asked to buy their own medications, drip, glove, gauze, infusions, and all those things. A lot of things in the night when you go to the hospital, there is usually no light, and the mosquitoes are as big as my hand. I can tell you that if you go to UPTH A&E in the evening.
Kelvin, when did you leave?
The reasons.
When did you leave Nigeria?
They don't solve these things.
When did you leave Nigeria?
When did I leave Nigeria? 2019.
Yeah. What if I tell you? What if I tell you the mosquitoes are not that big now? The latest report as of today.
I know. The latest report, they are not that big.
Yes,
but they
the
are still mosquitoes.